Once an aneurysm is treated or once an aneurysm is diagnosed, there are so many factors involved for the outcome. So one is the early diagnosis, either by CT angio or DSA or MR angio. Then the early intervention. So in the intervention, we need to be, the expertise should be so good that we only clip the aneurysm and don't play with the normal blood vessels. So once a normal blood vessel is injured or something while doing clipping, then the chance of having a stroke is quite high. So even the clinical expertise, surgical expertise, both intraoperatively or in the cath lab where we do a minimal invasive coilings, the coil should be exactly placed in the aneurysm rather than spilling into the normal blood vessels. So anything happens, then chance of having a stroke is quite high. So pre-op diagnosis, early intervention, good intervention, and post-op management is very important for the aneurysms because we need to maintain good hydration to the patient, good volume should be maintained within the blood vessels, level of blood pressure to be maintained to prevent something called a spasm. For example, unlike a brain tumors where I do a good surgery, the chance of patient recovering is 99 to 100%. But that's not the way aneurysm is. So even I do a good surgery or good intervention is done, still the chance of patient landing up in some problems is there because of the innate nature of the bleed. So because of the bleed in the brain, the chance something called spasm of the blood vessels happens. That happens from 3rd day to 21st day. So patient needs a good ICU care for the next 2 weeks to prevent these complications. So all these factors, the patient condition, early pre-op diagnosis, early management and a good follow-up ICU care is always is very much required to have a good outcome for the patient.